अस्सलामु अलैकुम, मेरा नाम अमतुल यमीन है and my roll number is BP1650029 and the topic is about Amphotericin B, that is a antifungal drug. It was isolated from Streptomyces nodosus and it is commonly used for these candidal infection, cryptococcal infections, blastomycosis. These are some infections which are fungal infection, and this drug is used to treat them. The next thing is its use. It is a first line therapy for these aspergillus and candidal infection, but in the case of protozoan infections it is used for life threatening condition, not for as a first line or as a first priority for protozoan infection. The next thing is adverse effects. The most common adverse effect or symptoms were seen as hypotension, nausea and headache. These were the most common ones. After adverse effects we have doses, that is in through IV and per oral. If you are giving it IV, then 0.25 to 0.5 mg per kg is suggested, and if you are taking it per oral, then 1 mg per kg is suggested. The contraindication for this drug is the person or the patients who are sensitive to amphotericin obviously are contraindicated to amphotericin. The renally impaired patients and patients with liver dysfunction cannot take this drug. Interactions: these are some drugs and class of drugs which are obviously contraindicated because they are increasing the risk. Here, like cytostatic drugs and aminoglycosides, they are both increasing the kidney damage or renal damage. So it वैसे भी आप एम्फोटेरिसिन रीनली इम्पेयर्ड पेशेंट को नहीं दे सकते, और आप इन ड्रग्स के साथ तो नहीं, बिल्कुल भी नहीं दे सकते, क्योंकि ये किडनी डैमेज और रीनल डैमेज का रिस्क इंक्रीज़ करती हैं. नॉर्मल पर्सन के लिए भी ये इंटरेक्शन जहन में होना चाहिए. These are some alternatives and these are also antifungal drugs. Case study: here we have a case of 72-year-old female. She was admitted to the hospital because she was having a fever, headache and poor appetite, and she had the history of splenomegaly. So the examination goes on, and that examination shows mild tenderness at upper right abdominal quadrant, and the CT scan of the abdomen shows a 3 centimeter low lesion in the left lobe of liver. The specimen of blood and abscess and cerebrospinal fluid were taken, which all showed Cryptococcus neoformans. That shows she has cryptococcal infection obviously. Then the plan for her is Amphotericin B treatment at a dose of 0.6 mg per kg per day at initial stage, and if her condition improved after treatment, then the liver ultrasonography will be performed 4 weeks after the initiation of treatment. That means 4 weeks duration will be given for the improvement, and if the reduction in size of liver abscess is reported, then ultimately the patient received a cumulative dose of 1335 mg of amphotericin B after 7-week treatment.